Authorities in Kenya have announced that from the 21st of December, everyone who's not vaccinated will be barred from using public transport and accessing government buildings. The Health Minister, Mutahi Kagwe, says that the measures are aimed at increasing the rate of vaccinations ahead of the festive season.
Health Minister Mutahi Kagwe made the announcement affecting schools, transport services, immigration and other state offices, hotels, bars, restaurants, national parks and wild reserves on Sunday. And the government will start a 10-day mass vaccination campaign this coming Friday. Directives about vaccines have split public opinion globally. Some politicians and citizens say measures infringe on personal choice, and others say they protect the public.
They ought to have done a door-to-door campaign, as they do for polio, vaccinating people from house to house, instead of saying that they will deny access to public services because the government serves us all.
Though low compared to Western nations, Kenya's rate of fully vaccinated citizens is higher than the African average of less than 5%. The WHO says Africa lags in COVID-19 vaccination rates due to global inequities in vaccine supplies, not because Africans do not want to be vaccinated.
By the time lockdown,
they ought to have done a more aggressive vaccination campaign before lifting the lockdown. Because with or without vaccine, we still have to wear our masks. I don't understand why they want to make our lives more difficult.
The edict comes just a month after the government lifted a curfew in place since March 2020.
It's going to be difficult because who is going to implement it? Me as a business owner, if I'm told that I cannot allow customers and yet I am in business paying my licenses and I'm being told I should not allow customers, I don't think it will be practical. Some of us might want to be compliant, others will not. So it will create some unfair competition, you see. Because I won't turn away a customer, yet I am here to make some living. When COVID was there, we closed for a period of 8 months. All right, so we just opened. We're trying to bring the customers back. Again, for me to try and tell these customers that we can't have you because of perhaps you don't have, or you've been vaccinated maybe once, there is a second dose you need to go to. I'll tell you, go away and come back another time. I don't think that's going to be practical.
Well, for more on this, we're now joined by Amnesty International's Kenya Executive Director, Irungu Houghton. Thank you very much indeed for joining us and welcome to the program.
Thank you very much and thank you for having us.
All right, so government is doing all it can to try and get as many people vaccinated as possible, potentially saving lives, but you're not happy. Why?
I think we have to look at the new provisions within a particular context. In March, the beginning of this year, we had very few vaccines in the country, and Amnesty International Kenya urged the government to focus on particularly those people that were on the front line, our health workers, our law enforcement agencies, officers, and those that had underlying medical conditions. We also asked the government to prioritize the elderly. We have been very much in favor of vaccination, but we have stated that it has to be voluntary and it has to be accompanied with mass public education programs that allow for people to make the choice powerfully, knowing that in many ways the vaccine is the best form of protection against the COVID virus. I think the guidelines that were announced yesterday are a departure from the stated public position that the minister took in January of 2021, that vaccination would remain voluntary, that it would not be enforced or essentially coerced against people's wishes. And I think our major concern is that these new provisions suggest that come December 21st, there will be a number of people who will not be able to exercise their right to work. They will not be able to exercise their right to essential services like education, health and security, and definitely they will have no freedom of movement. And there are many other reasons why this is a bad idea.
All right, so the one side of this equation is that if everybody gets vaccinated, then it'll be quicker to get to the point where everyone can move around freely, the economy can kick off, and people can earn a living. Is that not a compelling reason enough to try and encourage people to get vaccinated? Or are we saying that there's no way they can vaccinate that number of people?
Well, I mean, first of all, encouragement is one thing, coercion is another. Threats don't work in the Kenyan context, like in many other contexts, for several reasons. One is that if you coerce a population to do something, it tends to take shortcuts. I will predict that within weeks we will have fake vaccine certificates available for people that will be produced in the back streets of Nairobi, and that will just undermine the entire effort, and particularly the progress that we've seen in terms of uptake. At the moment, we are at 8.8% vaccination uptake. The other concern really is that for many countries that have gone this route of introducing mandates for public and private facilities, they've done this when at least 60-70% of their population are vaccinated. It is completely unrealistic for the ministry to assume that within 1 month we will be able to go from 8.8% to 60% within this period. It's just not possible. By its own admission, the government only has vaccine supplies for 15% of the population and requires a lot more resources to be able to reach all Kenyans. So it's just, the predictable outcome of this policy is December the 21st will come. We will have a number of people who have not yet been vaccinated, and they will be locked out of essential services. And let me just add that, one of those services that has been declared is the right to health, public health services. And how can you deny public health services in a pandemic? It's just, a recipe for disaster. I think the other thing that I wanted to just raise,
just before you carry on, I just want to be clear. Are you saying that if you're not vaccinated, you'll not be able to enter a hospital?
Well, the guidelines are very clear. I mean, they've spoken about a number of different spaces and services that you will not be able to access. So in the update yesterday, it will be mandatory that anybody seeking in-person government services, and let me be specific, immigration, taxation, education, health, and prison visits will not be able to access, you will not be able to access any of these in-person services unless you have a COVID certificate that declares that you have had both jabs as required by the Ministry of Health. The second thing is that you will not be able to access hotels, restaurants, public spaces, or national parks unless you have vaccinated fully. And lastly, you will not be able to access places of worship or small and medium enterprises, any business enterprise that has more than 30 employees. All of these will be out of bounds for Kenyans unless they have completed the 2-jab regime that is required.
And this could have a devastating impact on the economy, jobs. It almost sounds catastrophic if this goes ahead.
No, I mean, I think predictably what will happen is that it'll be unenforceable, that private businesses will not enforce it. They will not require people to demonstrate certification because it's just unworkable. Public service vehicles will not require people to show their certificates as they're traveling. And really what you will have essentially is a large-scale criminalization of those people who have not yet vaccinated. And just to be clear, the vaccination has gone extremely well in the urban centers, in places like Kisumu, Nairobi, and Mombasa. But in some parts of the country, particularly in the north, where you have large, you have small numbers of pastoralist communities across large areas in the north and the coast of Kenya. These are areas that have yet to be touched by vaccination drives.
All right, so help us understand what needs to happen then. It sounds as if there is not enough vaccines to get the kind of numbers that the government wants done to get done. So if everybody rushed to go and get vaccinated tomorrow, they just wouldn't be able to cope with the numbers. First thing. Second thing, the people who haven't been vaccinated, is it because they never want to get vaccinated, or they're just taking their time?
No, I think there are a couple of things. We have had a couple of studies that suggest that, the early adopters, the people that were eager to vaccinate, that many of those have done that. And, Kenya is one of the countries in which there wasn't vaccine skepticism for most of this year. There was mostly just a problem with supply and distribution. We just didn't have enough vaccines available for Kenyans to vaccinate. So that's one constituency that have gone ahead, and they represent the 8%, nearly 9% of people who have vaccinated. There are a number of people who, after the lifting of the curfew and the lockdown about a month ago, they have not gone back for a second jab, or it has slowed down the number of people who are coming for for immunization. And then I think there's a third group that yet to have to be persuaded. And sometimes it's not that people are fearful of the vaccine, but it's also a number of young people who just simply say that what they've seen is that this virus doesn't affect them directly, and they would prefer that the vaccines go to their parents and to the elders. And of course, as Amnesty International, in our work that we've done with communities, we've stated that it's not just protecting young people, it's also about protecting the elderly, and that you may not be vaccinated, but you can be a carrier, and therefore it is critical. In fact, it is a game changer that as many people get vaccinated as soon as possible. And looming for all of us is not just a potential another lockdown, but also a fifth wave that might come through towards the end of this year. And I think in 10 months' time, we have an election that we need to conduct, and vaccination will be a game changer for a smooth election.
All right, so, people might say, okay, on the one hand, it does seem as if it's a violation of people's human rights to be forced to take a vaccine. But on the other side of it, that there is sometimes an overriding factor where they say, we will take away some of your rights for the greater good. Is this not one of those circumstances?
Yeah, I think the WHO have created international standards for this conversation. There are legitimate public health reasons why as many people as possible need to be vaccinated, or that measures should be taken to create the opportunity for people to be vaccinated. But I think it's really important to remember at the end of the day that, depriving people who have been in a pandemic and an economic recession and endangering their right to work, their right to basic essential services, and their freedom of movement, that this cannot be a way in which we actually create the conditions for opening up the economy again. I think there are other options that the government could pursue, and some of these they have been pursuing this year with great success in some ways, in the sense that we have seen rapid uptake of vaccination, particularly from around August onwards. But I think, international standards dictate that if you are to have a mandatory vaccination approach, that you need to make sure that it is within the law, it is legitimate, it is necessary, and that it is time-bound. And lastly, that it is not discriminatory to large numbers of groups, and in particular those people who are poor and vulnerable or marginalized economically. I can see essentially that it is those communities, the elderly, people with disabilities, the vulnerable populations that are in the semi and arid areas, who will be inconvenienced if not denied their basic rights to freedom of movement and to basic essential services. So I think there are alternative things we can do. I think the government needs to repeal this set of guidelines as quickly as possible. I think they can create a clear framework on how they want to reach those hard-to-get populations, and in particular the elderly, who are not doing so well in terms of uptake, in terms of vaccination. But more importantly, also to start reaching those parts of the country where it is not, it's not clear yet that we have had major success in terms of vaccination. And then lastly, I think, civil society organizations like Amnesty and others, and the business community can invest in public education and public awareness campaigns, really to increase levels of vaccination rates. I don't think at this point it's helpful to panic and start to coerce people to do things against their will.
you make a compelling argument. Have you made representations to the authorities? Have you engaged? And what are they telling you?
Well, the announcement came just yesterday.
Right.
We've released a statement this afternoon that I'm sure has reached the highest levels of the Ministry of Health. We will be reaching out to them in the course of this week to essentially counsel them to go back to what was working, which was really this idea of mass programs, mass outreach. I think that will be much more effective as we go into the period. I mean, I think obviously the concern of the Ministry of Health, which we would share, is that we are going into the holiday season. And if people are not going to wear their masks and they're not going to sanitize and they're not going to avail themselves of vaccination, then we could see a fifth wave. But I think the fifth wave, the good thing at the moment is that actually the number of infections are quite low. I think we're in single-digit infection at the moment, and therefore we do have time to be able to encourage people to do this. And the uptake has worked in terms of voluntary, and voluntary accession and voluntary representation of people before the health centres. We just need to encourage more people to do that.
What we've seen, looking at other countries, I'm thinking about America, that when you ask people to do it voluntarily, it'll only take you to a certain percentage. And then there's that last percent that people just dig in, and you almost have to force them. So that maybe you do it in phases, you get as many people to do it voluntarily as possible, but it seems as if there comes a point in time where the last stretch has to be compulsory, otherwise you won't get over the line.
Yeah, but I think we have to push back on this idea that the fact that people don't wish to be vaccinated are grounds for them to be criminalized or to deny basic services. I mean, it's somewhat hypocritical to deny people the right to health, education, security, but not to suspend, for example, taxes. If they're not going to access services, then why should they pay taxes? Why should they be expected to act responsibly as citizens when essentially they're not going to be able to access public services? I think the other part of this is that there are a lot of private services that are so critical for people to be able to feed themselves, to be able to take care of their families, and simply reducing, it's almost like a semi-imprisonment strategy to have people to vaccinate. And I think persuasion has always worked very well with Kenyans. As I said, you push this down the throats of Kenyans, and they will find ways of finding fake COVID certificates. And again, that would just really undermine the progress that we've made so far.
But if you can see this, I mean, why is it that the authorities are making decisions knowing that this is possible?
Well, I can't really answer for the Health Ministry or the National Emergency Response Committee. I think that would be a great conversation to raise with them. And, the ministry has, and particularly the minister, the team have actually managed this relatively well over the last couple of years. I mean, they've chosen to go for public health guidelines rather than a state of emergency framework. They have course corrected at the beginning of the year. In fact, South Africans may be interested to hear that the very first person who died in mandatory quarantine was actually a South African woman who was here on holiday, and she just was put into a center without much psychosocial support and just went into depression and unfortunately committed suicide very early in the curfew and the lockdown. They've course corrected those measures. We now have home-based care. There were moments when they overreacted and closed down the entire country rather than just focusing in on those areas with high infections. But generally, the Health Ministry has worked very well given the challenges and the speed at which we've had to adapt to a global pandemic, which really, to be honest, the scientific information and the epidemiological information has changed almost on a monthly basis. And it doesn't matter whether you are a rich country like the United States of America or European countries. African countries have had to adapt extremely fast, and therefore, I think it would be a shame to really essentially just take a step back from those successes and move in this direction. But I do hope that there will be enough public pressure and scientific pressure that will lead to the government adopting a different path.
All right. Earlier on, you talked about immigration, hospitals, and access to the economy being compromised. Public facilities include education. Are they going to be out of bounds as well?
Well, I assume that, part of the guidelines also spoke about extending vaccination to teenagers, which, given the information that we're now hearing, this is encouraging that we will be able to also vaccinate our young people as well. But I think, it does affect, these guidelines would affect, for example, university students. It would affect the youth who are, over 60, 70% of the population. And I suspect that that's, it is really the population that are in the informal settlements, that are in rural communities, that will not be able to move as fast as the ministry would like them to over this month. And therefore, one wonders how you will enforce this in a remote village or a remote set of villages in the 47 counties across the Republic. The other concern really is this issue of what will employers do when employees can't come to work in a month's time. And that's not just the formal big employers, but it's also the informal sector as well. So it is possible that you will see a cat and mouse game between the police or whichever agency is committed or is detailed to enforce this order. I think one of our concerns has been during the last year or so is that with curfew management, we saw a lot of police brutality. We saw a lot of excessive force. I think as Amnesty, we are worried that this opens the door for another round of use of lethal force to enforce something that is clearly impractical.
Irungu, Houghton, we're going to have to leave it there. Thank you so much indeed for joining us. Perhaps we'll have another conversation soon just to see how the authorities respond to your statement. And let's just hope sanity prevails. Thank you so much.
Thank you very much for having us on.
All right, that's Amnesty International's country director, Irungu Houghton, speaking to us from Nairobi, concerned about government legislation saying that everybody must be vaccinated by the 21st of next month. If not, you'll not have access to public facilities. Now, President